How do MSLT results diagnose conditions like narcolepsy? Imagine feeling extremely sleepy during the day, even after a full night's sleep. You might wonder if something more is going on. That's where the Multiple Sleep Latency Test, or MSLT, comes in. This test helps doctors figure out if your sleepiness is caused by narcolepsy or other sleep issues. It is often used after an overnight sleep study called a polysomnography. The overnight test checks your sleep patterns and rules out problems like sleep apnea. Sleep apnea causes interrupted sleep and can make you feel tired during the day, but it doesn't usually cause the same quick sleep onset or early REM sleep that narcolepsy does. During the MSLT, you will have 5 nap sessions scheduled to hours apart during the day. Before this, you will have already completed an overnight sleep study. Each nap takes place in a quiet, dark room where you lie down comfortably. The goal is to see how quickly you fall asleep and whether you enter REM sleep during these short naps. The test records your brain activity, eye movements, and muscle activity to see what stage of sleep you reach. If you fall asleep within about 8 minutes or less on average, that's a sign of excessive daytime sleepiness. But the key feature for diagnosing narcolepsy is the presence of sleep-onset REM periods, or SORMs. Normally, REM sleep begins about 90 minutes after falling asleep at night. In narcolepsy, REM sleep can happen very quickly, sometimes within 15 minutes of falling asleep during the nap. If this happens in 2 or more of the 5 naps, it strongly suggests narcolepsy. The test helps doctors see if your sleep patterns are abnormal, especially the early intrusion of REM sleep during the day. This test is especially helpful because narcolepsy involves problems with REM sleep regulation. It causes REM to appear too early and too often during naps, which is not typical in other sleep disorders. The MSLT can also help distinguish narcolepsy from other causes of sleepiness, like idiopathic hypersomnia, where sleep latency is short but REM sleep doesn't occur as early or as often. In some cases, doctors will perform the MSLT after an overnight sleep study to make sure sleep apnea or other issues are not the cause of your symptoms. Since sleep apnea causes fragmented sleep, it can lead to daytime sleepiness but does not usually produce the quick sleep onset or early REM sleep seen in narcolepsy. So, the MSLT helps clarify whether your sleepiness is due to narcolepsy or other sleep problems. In summary, the MSLT results diagnose narcolepsy by showing if you fall asleep very quickly during the day and if REM sleep occurs unusually early during your naps. These findings help doctors tell the difference between narcolepsy and other sleep disorders that cause tiredness. This makes the MSLT a vital tool in understanding and treating sleep issues that affect your daily life.